What birth control should I use while breastfeeding? You do have some options. Let's talk about those. Are you ready? Let's go. Hi, Mommy. My name is Mary Cahill, and I'm a certified lactation counselor. I help mommies like you to be confident and successful in their breastfeeding journey. Breastfeeding in itself can be a natural form of birth control. The natural method is called LAM, L-A-M, and that stands for Lactational Amenorrhea Method. Now, for this to work out, you need to meet all of the criteria, and in our busy lives today, that's really hard to do. But if you want to think about this method, here's what needs to happen. You need to be less than 6 months postpartum, and you need to feed baby directly from the breast at least every 3 to 4 hours with no more than a 6-hour stretch at night. And you need to have not seen your period return at all. Another good form of birth control for breastfeeding moms is the barrier method, like condoms. But a lot of moms prefer to use birth control pills. And if that's what you would like to use, be sure to talk it over with your doctor. Always be sure to remind your doctor that you're breastfeeding. Even though you know they know, it's good to remind them. The preferred method for hormone-based birth control for breastfeeding moms is progesterone only. Now, this can come in the form of a pill, a patch, an injection, or an implant. Now, even moms who take progesterone only can still have problems with their milk supply. So it's really recommended that you start with the pill first, and that's usually the mini pill, so that you know that you're not going to have any issues with your milk supply. If that works out great for you, then you might move on to the patch or an injection or the implant. But it's easier to stop the pill if there's a problem than to try to get the implant removed. Most moms do best with a progesterone-only birth control pill, but you still need to monitor your milk supply. Now, the other form of hormone-based birth control is a mix of progesterone and estrogen. Now, that's not usually the first choice for breastfeeding moms, but you need to talk it over with your doctor. If your doctor feels like that's a pill that you need to be on, then you can be on that and just monitor your milk supply. Some moms do great, but it's just not usually the first form that doctors go to. It's best to not start any hormone-based birth control until your milk supply is well established, and that happens at about 6 to 8 weeks. Lots of moms start birth control at around 8 weeks postpartum, and that's also when your milk supply will regulate down just to what baby needs. So sometimes, because these happen at the same time, moms will think, well, my birth control affected my milk supply, when it really hasn't. So be sure to ask for help if you're not quite sure if your milk supply has dropped or if the birth control is affecting your milk supply. I have a video on how to tell if my milk supply is low, and I'll link that for you if you want to watch. You can monitor your milk supply and be sure that baby's getting enough to eat by counting wet diapers. As long as baby has 6 or more wet diapers every 24 hours, you know they're getting enough to eat. If your milk supply has gotten low, you can get it back up. The best way to increase your milk supply is to have baby at the breast for as long as possible and as often as possible. I hope this video has been super helpful for you, Mommy. Let me know in the comments, what are you thinking about choosing for your birth control method? If you have any questions, let me know and I'll get back to you just as soon as possible. But could you do me a favor and subscribe to my channel? That way, YouTube shows my videos to lots of other moms. I'd really appreciate it. Thanks a lot, Mommy. You got this.